Hello, my name is Jamie Rose, and I'm currently going to school to be an ASL medical interpreter. There is no doubt that non-English speakers have a more difficult time within the medical setting. Language barriers make it difficult for deaf and hard of hearing people to effectively communicate with their doctors and physicians. The lack of effective communication can lead to patients facing challenges while understanding their health conditions, and it increases confusions surrounding their diagnosis. Eventually, all of these problems can make healthcare professionals unable to provide the appropriate care. This can lead to a stressful patient-care relationship and ultimately dishearten the deaf or hard of hearing person. Ethical issues within the interpreter field require critical thinking to work with our patients and make them feel comfortable while accessing medical care. If an interpreter of any kind behaves unethically, their career will be very short. The three most common ethical issues faced while being an ASL medical interpreter include the lack of established signs for specific medical terms. How do you portray the message to your customer properly? Do you fingerspell it out, or do you combine specific signs in order to portray it effectively? Next, you're never allowed to accept gifts from the parties that you're interpreting for. Lastly, you must remain the interpreter and never offer advice or your opinion. From this last issue, I offer you a scenario. You've been hired to be an ASL interpreter for a deaf person, and you're accompanying them to a doctor's appointment. During the doctor's appointment, the physician shifts the focus from the patient to you and starts asking you questions about your field. How did you get here? According to the languagedoctors.org, in their 2021 article, Problems with Interpreters in Healthcare, a complete guide, language barriers affect healthcare and cause a higher risk of healthcare mistakes. As a result, healthcare teams face difficulties going over the medical history of their patients. It leads to poor comprehension of the problem at hand regarding the diagnosis. It creates a massive problem regarding the issue with informed consent and documentation. The solution to this problem would be to step out of your role as the language conduit and into the clarifier role. You should explain in both languages that you're only there to interpret and cannot answer any questions directed towards you. If it continues, stop the conversation, clarify again, but from there on out, interpret exactly what they're saying. It's important to keep a professional distance within this profession. Getting too involved with your customer could create further ethical issues and put your career at risk. Thank you for listening.